Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Yep, and by the way, we are an equal opportunity player. You can go to our website, veinclinicsofhawaii.com, and find out a bunch of stuff about all the shows that we do. Well, when Dr. Juliff sent me a lineup of the show that we're going to do today, I thought this is going to be a lot of fun because, I know that there are some times if you're sick or if you're ailing, it's not much fun. And, if you don't want people to make fun of it, but there's humor everywhere, and particularly in some of the patients. And today, Dr. Juliff sent me a thing, and it was Mythbusters, the Venus edition. And I thought to myself, there are a lot of people that either are in denial, like we've done on previous shows, or they are try to explain something away or either over or underemphasize some things. And so that's kind of one of the things we're going to do today. And I would imagine, first of all, Dr. Juliff, before we start, you must sometimes have to bite your lip when people come in for the first time to your office, or no matter how they've come in there, and you say, I can't believe this person thinks that.
Yeah. Well, and that's what kind of brought to mind doing a show like this, because, some of the things we're going to talk about are serious, but some of them are not. And it's always, I don't know, entertaining, I guess, hearing people and how they rationalize things or how they have come to, understand them, and it's like just way out of left field. But they don't know. That's just what they've been told, or what, old wives' tales.
Yeah, and by the way, I can tell you as a dad, as a granddad, now a great-granddad, kids and children will say the strangest doggone things. And you've either, muscled up with a bunch of objections or a bunch of rationale to sort of rationalize something. When somebody says, "Hey, Papa, what's that big thing on your leg?"
Yeah.
And what do you say? Well, that's some of the things we're going to talk about today. Aren't most people looking for a reason why they have something wrong with them?
Yeah, I think so. Yeah. Unfortunately, they often chalk it up to the wrong reason, and they don't, immediately get to where they should. Sometimes they take a roundabout way, but when people have a problem, they want to. For the most part, I think they're looking for
an answer.
Yeah,
and if they answer themselves and they believe it, that'll get them happy for a little while.
Yeah.
The first thing on the list is when somebody says, I know why I've got this. I've worked on cement floors my whole life.
Right.
Yeah. Well, don't we all? In some respect, there might be something on top of the cement.
Well,
but
exactly. That's true.
Yeah. But one of the things is, I think what they're really saying is, I've been standing up all my life or in my career.
Yeah, exactly.
Is that alone something that will cause you venous insufficiency?
In and of itself, probably not. Mm-hmm. But at the crux of most people's vein problems is a hereditary thing. Mm-hmm. You usually there's some genetic reason why you're sort of predisposed to develop venous insufficiency and varicose veins, but standing is one of those things. People in professions where they have to stand, they are definitely at a higher risk for developing venous insufficiency. But for some reason, over the years, it's always become sort of, if it's a cement floor, then it's particularly bad.
You won't have the vein problem if you have a nice thick carpet.
You need shag carpet, and then
I'm thinking even core balance is pretty hard on some of these floors. You sink into them; they're so plush and so carpeted out. Okay, well that being said, I do know that more and more of us do end up working later in life, and a lot of it is at jobs where you are standing up. Maybe you're a desk guy your whole life at a bank, and now all of a sudden you're a greeter at the big box store.
Right. Yeah, sure.
That's a cement floor.
It is. Yeah.
Okay, number 2, and I love this one because I think I've used it. Don't worry about it. That vein's broken.
Yeah.
Can the veins break?
Well, but I see this all the time. People come in and they'll point at either a big spider vein or a little group of unsightly kind of veins, and they invariably call it a broken vein. And the vein itself is, it's abnormal, but it's not like the vein has burst and broken open or anything like that. And also typically I when they say that, I often say, well, listen, that's just one. Yeah. You have a lot of broken veins.
Yeah.
But that's okay because we're going to fix them.
We're going to fix them all. But interestingly enough, and you've explained before, in the venous system, you have the arteries in the arterial system, and those veins, those arteries have a lot of pressure because that pump is just spewing it through your whole body.
Right.
But there isn't seemingly the same amount of pressure in any means going back up.
Uphill. No. The venous system is definitely low pressure, so
they don't blow up.
Yeah, so they don't blow up.
Yeah. Okay, now this is a good one, and this is where there'd be a couple of different schools of argument here. This one is varicose veins are just cosmetic, so I don't really need to do anything about them. Well, let's talk about that because I guess that a lot of people think that of spider veins. They don't cause me any trouble, but do they? And what about these varicose veins that you can see? Nothing's going to happen.
Yeah, well, we hear a lot of patients come in and they can have really terrible kind of disease. Big, huge varicosities and all that goes along with it. And, not uncommonly, somebody will say, well, am I just being vain by coming in here and wanting and asking you about this? And I say, absolutely not. You need to be here. Yeah. But it's surprising the number of times people do get told, the varicose veins is just cosmetic. Now, I can tell you that with a very, very high likelihood, if somebody has true varicose veins, then they have significant underlying venous insufficiency.
Let's make sure that everybody knows that. Dr. Julep, the medical director, you can go to veinclinicsofhawaii.com and see a lot of things we're talking about. But today's show, hopefully it's a little bit of fun, but it's also going to shine a light on some of these myths could harm you. If you buy into something, it may not be so good. For instance, most of these veins, the big obvious ones, usually are on the back of the leg. Maybe because the front of the leg there's not enough. I don't know why, but less skin.
It's right over the bone.
Fewer veins.
Basically fewer veins right in that area, but. Varicose veins, it's funny now that you bring that up. When they arise in different people, often they do take the same pattern. We see a lot of varicose veins kind of on the inside of the leg, but then there's another group of varicose that come off sort of the front part of the thigh and go off to the outside of the leg. So, but they can be very, very similar in their pattern in different people. But I think the point here is that if you have varicose veins, then you definitely have a problem that needs to be looked at.
And certainly there's going to be stuff inside that you can't see. And that's why we talk about the diagnostics and what are some of the tests and the ultrasound. We'll get into that in a minute.
Yeah, and that's the good point right there that you made, Mike, because in order to have a varicose vein, varicose veins don't just arise from themselves. I mean, varicose veins typically are not the problem. The root problem is a problem with the function of the vein that's a little deeper in the leg, and a varicose vein is a branch off of that vein.
So in many respects, it's good. I mean,
it's a sign.
Yeah, it's a sign that, okay, first thing we're going to do is, don't worry, ma'am or sir, we're going to take care of this, but let's go find out what's at the other end of it.
Yeah. So with varicose veins, very high percentage that there's an underlying problem. Now, with spider veins, not so much. Some people just have what we call sporadic spider veins. They just develop spider veins, and usually it's probably a hereditary kind of thing. But spider veins also can be an outward sign of an inward problem,
Sure.
the same way that varicose veins can be. So, for those people who have a lot of spider veins, even if they don't feel like they want to pursue doing something cosmetically to get rid of them, still, there should be the question, gee, do I have underlying vein problems?
Somebody asked me to ask you this, and it'll fit in with what we're talking about here today. Spider veins, as far as I can remember from previous discussions, are elective procedures that somebody says this is a vanity thing. It's like getting their eyebrows done or something. So some people are, I don't want to say vain, but some people say, look, I'm outdoors. I'm working around. I'm a swimming instructor. I got to look better. How come I can't get a prescription? Or how come my insurance company won't understand that I got to look good out by the pool?
Sure.
Maybe we ought to work on that.
Yeah.
Okay, how about this one? I, for many, many years, because many of you know that, I hate admitting this, but I was once discussed as being morbidly obese. Thank goodness no longer. But that was back in the day when I said, I think crossing your legs is silly. Probably because I couldn't, back in the day.
Yeah.
But I do notice that there's another one here on this list. And crossing my legs are made me develop these unsightly legs.
Yeah.
Any truth to that at all?
Probably very little to none. And yeah, that's one of those old wives' tales that, if you cross your legs too much, you're going to develop varicose veins. But again, we know the reason why venous insufficiency and varicose veins occurs. It's by and large, in most people, it's a genetic problem. In most people, either, your mother, your father, or both had it, and so the likelihood of you developing it at some point in your life is very, very high. And then the other risk factors, standing, like we mentioned before, those professions that stand a lot, they're going to be at a higher risk. Pregnancies, multiple pregnancies put you in a little higher risk for developing venous disease. Obesity, we've talked about that. So, just crossing your legs is not going to just, produce venous insufficiency.
Okay, devil's advocate. What about I have venous insufficiency and I cross my legs all the time? Will it make it worse? Okay, we know it didn't make it happen, but can you irritate varicose veins?
Well, that's a good question. You could, but you'd have to be don't your legs in exactly the same way for very long periods of time.
And everybody knows people move around a little bit.
Yeah.
Okay, I love this one. In Dr. Juliff's list, it says here, I got hit by a soccer ball when I was 15, right in that area.
Yeah.
And I didn't ever get hit by a soccer ball because I never really understood that sport when I was a kid.
Right.
But a lot of baseballs. And a lot of times you get whacked with a line drive if you're a pitcher, and that thing will be the biggest old bruise. Can that cause a varicose vein or a vein problem?
Yeah, typically not in that setting. But we do hear that a lot where people will come in and say they got hit by something, and it was like a long time ago when they were a kid or whatever. And, very likely it's just coincidental that 15 or 20 years later they developed a patch of spider veins in that area.
Doesn't it help to explain it away, though, if your kid says, when I was a little kid, I got hit by a baseball?
Sure, yeah. Well, and people, again, getting back to why they think that way, they've heard other people say it many, many times before. So
we've mentioned before that in other shows, and we're going to talk about it today because this next myth that we're going to bust is about inheritance, not the money, but the condition. My mother had a varicose vein right there in the same area that I have.
Yeah.
Is that from her?
Right.
Yeah. Okay. So
well, yes and no.
Yeah.
Yes and no. I mean, again, varicose veins and venous disease is usually inherited. And getting back to what we were talking before, it is surprising. That the patterns of varicose veins that we see on different legs, time and time again, there is sort of a repetitive way that varicose veins will develop, depending on probably where in the system they're arising from and what vein it is that they're coming off of. But it's surprising how similar they can be. You would think that it'd be completely random, but it's not.
Wait until they start out with these new shows that they're doing now on your DNA and your Ancestry.com and all of this kind of stuff. I'm going to guess here. Everybody has different fingerprints, different other prints, teeth marks. Everybody is totally different. Is there any two, vein systems that are the same? And I would say impossible.
Probably not Probably not exactly the same.
Yeah.
No,
Okay.
they're like snowflakes.
We'll have to add that to the list. Okay, we talk about this a lot. It's something called phlebitis. Itis, by the way, as you know, if you've been listening, is swelling. So phlebitis, these are surface blood clots, are completely harmless.
Yeah.
Are they?
And they are not. No.
Oh, boy. What? Why?
Well, because phlebitis usually is another one of those peripheral sort of signs that indicate that maybe you have underlying venous disease that you're not really recognizing, or that hasn't developed completely. But what is phlebitis? Something that we call superficial venous thrombosis. That's kind of the medical term, but most lay people refer to that as phlebitis, and phlebitis is an area on your leg that becomes real red and inflamed and tender. It can be very, very painful.
Right.
And we treat it with anti-inflammatories and warm compresses, etc. And typically it'll resolve over a number of weeks. Often it takes a while to resolve. But what is phlebitis really? What is going on there? Well, basically what's going on there is that a more superficial dilated vein has thrombosed off. I mean, it's developed blood clot, coagulum inside the vein. And when that happens, it creates inflammation.
Are these the veins that are near the surface?
Yes.
Yeah, okay.
So even though you may not have, now often they occur in an area where a person recognized that they had a varicose vein, because essentially that's what the vein is. The vein that's clotting off is a varicose vein. Sometimes it's not real well developed, and the patient hasn't recognized the fact that they have varicose veins or dilated veins. And so phlebitis is often a warning sign that there are other problems along the lines of venous disease. So usually it requires evaluation. Now, so that's one side of it. The other side of it is that people who develop phlebitis or SVT, some number of those are going to develop DVT. Deep vein thrombosis. Deep vein thrombosis, which, as we all know, can be a lethal problem.
I remember reading something years ago about Richard Nixon, and Richard Nixon was, in my memory now, the phlebitis president, and there was very big concern at the Mayo Clinic and at other places because it was, I guess, that bad that he was in imminent danger of it becoming a lot worse. So it can escalate.
Oh, yeah.
Yeah, it can be a big issue.
Absolutely. And especially if it's not, evaluated and treated if need be. Phlebitis is not harmless, and invariably it should be evaluated and looked into. If you have an episode of phlebitis, you probably need an ultrasound to take a look at the vein.
See what's underneath there.
Sure.
Okay, as we continue now, these are myths. We're the Mythbusters today. There are no Mythbusters on the website, veinclinicsofhawaii.com. You can find some stuff. This show will be up there one of these days. You can listen to it. But by and large, you're going to find out the nitty-gritty of what it takes to get diagnosed and to schedule yourself for an examination or for treatment. So remember that. The Vein Clinics of Hawaii are on all the major islands. It's on the Big Island, Maui, on Kauai, and here on Oahu. We think it's very important that you know that because some of these things are fun, but every one of them has something serious. This next one, particular to me, it means a lot to me because I was a naysayer from the beginning of these things, and now I'm the Pied Piper of support stockings. And whether you call them support stockings or varicose vein socks or procedure or a document, not a document, a
garment.
A garment, which I want to call them a garment rather than a sock, will heal vein problems. If that was so, that would be an easy sell. I would have been jumping into those things if I'd have known that.
Sure.
But what do they do?
Now, not to say that stockings aren't ususeful. They certainly are.
Certainly they are for me.
We use them all the time with good effect. But I added this one sort of tongue in cheek because the insurance companies these days, one of the things that we have to do is to prove to the insurance gods that a patient wearing compression stockings is not going to miraculously heal them, and we have to typically people have to be in compression stockings for 2 to 3 months before the insurance companies will then allow us to go ahead with the procedural stuff that's actually going to fix it. So that's why I added that. But yeah, stockings are good with respect to addressing symptoms. If you have symptoms of venous insufficiency, compression stockings definitely are going to have a positive effect. And they're constructed in a real specific sort of fashion, like we've talked about before. They're not cheap, they're a little pricey, but they're worth every penny if you need them. There's no question about that. And they really can help the symptoms, but they're not going to fix the vein because the vein problem is a mechanical problem.
And that is what I struggled with a little bit back in the beginning. I now do it for this reason, because it does help deal with the symptoms and the problems during the day. And when you're up on your feet or having these compression socks, is making your blood being able to get back up through these veins and get into your heart and get repumped through your body. And so they say the minute you take them off, all is lost. And I'm saying, okay, maybe that's true. But if I've had them on for 6 hours and now I'm going to go home and elevate my legs for a little while before I go to sleep, I've had a winning day.
Yeah.
Because I've been compressed during the day and I've elevated at night, so I'm not at least making any of these conditions worse.
Right.
Don't know if they're helping.
Well,
but maybe they're not getting worse. That's what I'm counting on.
Yeah.
Otherwise, I'm giving you back all my socks.
Yeah. Well, I think with respect to swelling, which I think if in the long term, compression stockings are so useful with controlling swelling. Even after we've treated patients, many patients have multiple reasons why their legs might be swelling. We fix the venous disease. We do everything we can to optimize that part of it, but still there are some reasons why people will continue to have swelling. Something called lymphedema is one of those things. We've talked about that before. And unfortunately, there's not a good surgical technique to repair lymphedema, but compression stockings do a very good job at controlling the swelling and consequently some of the symptoms that can come along with that. But unfortunately, it's something that you have to do on a nearly daily basis. But everybody kind of finds the balance where they're happy with the amount of stocking use and the resolution of swelling or symptoms. And but especially in a place like Hawaii, it's very difficult.
Yeah, but I'm also thinking that there's a lot of athletes that have learned about compression as I don't want to say an enhancer, but certainly there's some people that it knocks down your rest time, and all of these things. So these are people that necessarily aren't sick. They don't have varicose veins. They don't have ulcers. They don't have anything, phlebitis, but they have more energy because of these things they wear. So how do you explain to a patient? Because I do know they are expensive, no question about it. A good pair of support hose, this garment can be anywhere from $70 to $100. I mean, sometimes they get quite expensive. So you got to tell somebody, take a leap of faith. Just stop. Just don't have a couple of fancy lunches or dinners, and if you take care of these things, they'll last a long time.
Yeah. That's what it boils down to. Because the more expensive ones are long lasting. I mean, people wear them for months, and they're just so well constructed. And constructed in a way that suits the problem. We call these things graduated compression. And that's because there's more compression lower down around the foot and ankle, and then it kind of lessens as it comes up the leg, and it's kind of meant to, make things sort of flow upward. But and they do.
Here's the thing that I like, that I've learned: do not have them in the dryer, okay? Because that money is going to go right out the door. Put them in the washer, not a problem. I put them in the washer in one of those mesh bags, and so they don't get completely agitated. But every now and again, I put one in the dryer. They don't like that; they get all frazzled.
Yeah.
Okay.
Yeah.
So here's one. This was the Equal Opportunity Mythbuster show. Here's one for you ladies. She says, "My veins went away right after I had my baby, so I don't have problems."
Yeah.
Okay. Does getting pregnant elevate the problem?
Yes.
Okay, because of what's happening in the change in your
well,
hips, in your pelvic area?
Well, there's mechanical, and then there's physiologic stuff that goes on while you're pregnant. You're the hormonal milieu of your body during pregnancy
feeding the baby
relaxes things, including our veins. The blood volume of a woman when she's pregnant increases tremendously. So not only are the veins dilating, but there's more blood going through those veins. And then also just from a mechanical standpoint, as the uterus is getting larger and larger in the pelvis as the pregnancy goes on, it's causing pressure, or it's creating pressure on a lot of the large pelvic veins, where the leg veins are emptying into.
And these are the big ones.
They're
you don't
big.
see their way inside your body.
Yeah. So, the pregnancy is, again, one of those things that is a risk factor.
Yeah.
But it's not like you're going to not be pregnant to avoid it, but it is a risk factor of developing venous insufficiency. Some women have it worse than others, but we hear all the time that, I started having vein problems after my second pregnancy, and then they got kind of bad, and then it went away, and then after my third pregnancy it got really bad, and then maybe it doesn't go away. But invariably, even if the major problems receded after a pregnancy, there's probably still ongoing issues with vein function that very possibly should be looked into.
Okay, so right out here in advance, ladies, we appreciate all you've done for us.
Yeah.
Because I guess it's not a lot of fun, some of this stuff.
Oh, no. No, I wouldn't want to have to go through it.
Okay, well, that being said, let's go to the other end. And I know there are a lot of female bodybuilders, lots and lots of them, particularly now. But here's another one. I love this one. I'm a bodybuilder. This is not me speaking, folks. I'm reading the list. Okay, I'm not a bodybuilder. I'm a bodybuilder. I don't have to be worried about large, huge veins. Boy, some of these guys, when you see them, they look okay. They get them. They're all oiled up, and gals too. I mean, it's actually it's really a equal sport these days. But they have some way of I don't know, pump. I'm going to pump you up. Remember that thing?
Yeah.
What happens? How does that happen?
Well, I think it's a combination of things, but for bodybuilders, I think probably. It's not only muscle activity and the veins getting larger and that kind of thing, but many bodybuilders have such little fatty tissue.
Yeah.
And
that body fat way down, right?
So it's like very low, and with the subcutaneous tissue on our body, it's sort of the veins run through that layer and the superficial veins. And when that subcutaneous layer goes away, then you can see the veins. Now, and we've treated a number of people who were very much into bodybuilding, and you can tell now. The process of lifting weights, you're straining your core. You're increasing the abdominal.
Got to know how to breathe when you're
pressure.
lifting weights.
Yeah. And that in and of itself is going to, I think, progress the problem of venous insufficiency and valve failure and all that comes along with it. Again, probably if there's the genetic predisposition for that to happen.
Well, some of these people, by the way, though, Doc, is the amount of hours they put in training and prepping and going to shows. It's no wonder that these things pop out.
Sure. But there's a difference. Typically when you look at people who are into bodybuilding, weightlifting, etc., and again, we've had a number of patients that have come in because of their veins, but most of the time you can identify normal vein from abnormal vein. Even on the surface of their body.
Okay, I get it.
And you're right. A lot of them they want the veins.
Yeah,
You know,
yeah.
because it's it's
Accentuates the positive. But see, there's another side to this that I'm glad you had that one, because I think it's important. It would seem that these veins being so close to the surface are subject to injury, and I mean they're right out there. But why is it that sometimes, if you're working really hard, and sometimes every now and again I'll be, doing a lot of work, moving rocks around the yard or whatever, you notice your veins they seem to be a little bit more prominent, a little sticking out. What causes that?
Well, in that situation, our veins, our superficial veins, play a huge role in temperature regulation of our body.
Okay,
so
I didn't know that.
when we get hot, there's a few things, a couple of things that we do to control or to maintain a very steady body temperature. Our temperature is pretty stable no matter what kind of environment we're in or whatever.
98 degrees, whatever. Right?
Yeah. So one of the things we do is sweat. We sweat, and then when we sweat, we're cooling our body because the wind or the breeze, hits the sweat, and it kind of cools your surface. Another thing that happens is that the superficial veins dilate. They're becoming closer to the surface, and the blood flow through those veins is actually emitting heat from your bloodstream. So in that situation, it probably has most to do with body temperature control. But I know what you mean. Yeah. Everybody sees that.
It's interesting because I've seen it when you're doing a lot of pulling. Like if you're a bottom fisherman, you're pulling up lots of weight from the bottom of the ocean. And yet the next day when you wake up, they're gone back to wherever they're just normal again. Right?
Sure. Right.
So it moves around. Okay, here, this one here I kind of like. One of the reasons why I became so enamored with studying venous vein disease, because I'm a patient, and I had a horrendous leg ulcer, which on previous shows we've talked about. We don't need to necessarily belabor the point about my particular situation on this stage of Mythbusters, but here's the one that I really get it. The ulcer goes away every time I get it treated, so I don't need further evaluation. I know that there are some people, Doc, that will have an ulcer that they don't even know what it is, and they do, some antibiotic ointment and Band-Aids, sometimes for weeks, sometimes for months, sometimes longer, and they just forget when they got the thing or what it was, but it certainly isn't healing. What's that all about?
Well, yeah.
It's healed. I don't need to get it treated.
Yeah.
Yeah.
And that's, that is an issue. Yeah. When in a couple of things, if somebody develops an ulcer on their lower leg or foot, and if it takes, longer than you typically would think it should take for it to heal, even if it does eventually heal, there may very well be a problem. There are many people in wound care clinics these days. I mean, there's a lot of wound care clinics around, which are very good places to get ulcers healed. But often the patient goes in and they do all the things that you need to get the ulcer healed. But the patient doesn't follow through and get fully evaluated because usually there is an underlying problem. Often, and most of the time, when you look at the people in wound care clinics with leg ulcers, the majority of those are due to venous disease, venous insufficiency. So every one of them should be evaluated from a venous standpoint. And if venous insufficiency is part of the profile, it needs to be addressed.
Okay, we can't show you the ulcers on the radio, but we can sure show them to you on the internet. If you Googled it, images of leg ulcers, you're going to be shocked. Don't do that when you're having food. But you can also go to the website, veinclinicsofhawaii.com, and talk about and see about these things. And more important, and there's also a lot, thank goodness, before and after video available or photos available on different things you can do there at the clinic. But I do know that one thing I learned from this leg ulcer that I had is it's not uncommon for them to heal, at least for a while, because you're treating it right. But from what I understand, that skin is never the same again. So unless you get the underlying problem treated, it may look like it's healed, but in fact, it's just waiting to pop open again.
Yeah. That's absolutely true. And that is, the notorious recurring pattern of the venous ulcer. Yeah. If you don't address the underlying problem, then it's very, very likely that it's going to recur. And then, the ulcer happens and everybody kind of gets focused on it and starts to do the right things to help it heal again. It gets healed, but then 6 months later it pops up again. And you're right. If you don't address the underlying vein issue associated with that ulcer, which is very often something that we call a perforator vein. We've talked about those before.
That's one that it's kind of goes sideways. Yeah. Your veins are up and down, and these go sideways, connecting one to another. Or
exactly. Yeah. It basically, the perforator veins are veins that connect the superficial venous system with the deep venous system. Okay. And very, very commonly, and those perforator veins are like other veins. They have valves in them that can fail. And when the perforator vein valve fails, then blood's going to go in the wrong direction. Now, what happens in that setting is that often that perforator vein is right under where that ulcer is.
Of course, naturally.
And
the planets have lined up. Yeah.
And so and that's the underlying problem, the vein, the reflux of the vein going through that perforator and creating, a milieu of that skin that is terribly unhealthy, and it won't stay healed. Yes.
That's really, and by the way, we've done this on other programs. Maybe we should spend a couple of minutes. The word ulcer is misunderstood. And I think that maybe almost everybody initially hears of ulcer, that somebody worried themselves into a tizzy and got a peptic stomach ulcer and was reflux and all of this kind of stuff. That's what most people think an ulcer is. But what you've explained to us, that an ulcer is a hole. It's a hole. And some ulcers will close up and some won't. And when we're talking about a leg ulcer, when you see some of these pictures at veinclinicsofhawaii.com or on the web, they are horrific. Yeah, they're very, very unpleasant looking. It looks like they ought to hurt, and it must be a portal for all kinds of other problems.
They often hurt tremendously. And you have to feel for these people, because often they come in and they've had these open wounds for months and months. But you're right. An ulcer, I guess in a word you could call it a hole. It's a hole through the skin. And it's got abnormal tissue associated with it, and a breakdown of just the normal physiology of all of that tissue. But it's something that definitely has to be addressed in a proper fashion to get it healed. And there's tremendous pain and suffering that people go through over a very long period of time until they finally get to the right place.
One of the things that I've been concerned about is a lot of the work that we do in the homeless community, and people that have these horrific ulcers that are in the worst place they can be, but some of them look like they're bleeding, but they're not. I've seen some pictures that look just horrific. Why does it look like they're not bleeding, but they certainly look like that? Because it's all pink and red looking.
Yeah. Well, it's just we call that granulation tissue. It's kind of the subcutaneous tissue. As it starts to heal, it has that beefy red kind of appearance to it. Many of those ulcers will have what we call an exudate, or just a fluid that's coming out of the ulcer, it can look pretty gnarly. Do you sometimes have to do skin grafting? Is there sometimes when the skin around an ulcered area, particularly if it's gone unchecked for a long time, just can't work anymore? Rarely though. Yeah, it's and I think that the whole process of wound care and wound healing has advanced so much over the last, I guess 15, 20 years, that it's really very infrequent that we need to do skin grafting the way we used to. 20 years ago. But by and large, if you take care of the underlying venous disease, if you handle the wound correctly. And again, there's all sorts of new biologic kind of coverings and stuff that lend itself.
That's what I was
to
going to
healing.
say. Sometimes that your skin will say, okay, since you finally figured this out, I'm going to give you one more chance.
Yeah.
I'll heal.
Right.
But, keep an eye on this. Now, here's one I really like. This is our Mythbuster show. Dr. Juliff, of course, the medical director of Vein Clinics of Hawaii. Please visit us on the World Wide Web and look at some of these things, and there's a wealth of information out there. Boy, am I guilty on this one. This is one where somebody self-diagnoses, that's nothing to worry about. The discoloration on my lower leg is from me being out in the sun a lot. I'm a kayaker. I get this because I've deserved it. Boy, oh boy, that is way wrong, isn't it? What is that all about anyway?
Often it is, we've talked about discoloration of the skin on the lower leg, and it certainly can be a sign of ongoing and untreated venous insufficiency that is going on for a long period of time. And when we see that brownish discoloration, that it is putting that patient into one of those little higher levels of classification that we've talked about before. And it indicates to us that that abnormal vein function process has been going on for quite a while, and gives us a little more concern, a little more urgency in finding out what the problem is and fixing it. There are things that can cause discoloration of the skin, but often it's due to venous insufficiency, but it's one of those things that people can often chalk up to other things, like being out in the sun.
Yeah, and that's one of the things that we talk about all the time. But the question that obviously is going to come up, so I know some of you out there are thinking, and you can't reach us now, but I'm kind of second guessing, is that let's say that you have this discoloration and that it's pronounced. Can it be made worse by getting sunburned? If you're out in the sun anyway.
It probably can.
Yeah. Because it's not in good shape to begin with.
Yeah, right? And sun does cause pigmentation of the skin in other settings. I mean, just in general. But it's probably going to worsen that discoloration that you might see with venous disease.
Okay, here comes another one, and we're sticking with this area. By the way, most of what we talk about, and Dr. Juliff, and we've talked on other programs and we'll going forward, is that, your veins and your arteries are in your whole body. But a lot of the problems are from the thigh down, and that's because that's the bottom of where these things are. So the next question, this also comes up to the discoloration. Well, the discoloration of my lower leg here is because I'm a diabetic.
Right. A lot of people think that. Yeah. And
it's partially true, isn't it?
It partially can be true, but many of those people often have venous insufficiency, and but again, it's one of those things that they're chalking up to some other reason, and a lot of it has to do with just not being informed or knowledgeable or having heard about it before. Part of the reason why we do this show is to kind of bring to light symptoms of the patients might have that aren't necessarily associated with venous insufficiency, but they are. Yeah,
and some of the things, gang, that we really love about the show is that it's very, very gratifying when a primary care physician or another specialist realizes that the patient that got sent to them would be better served going to a specialist, going to a venous specialist. And I do know that the same thing happens when somebody looks at things like phlebitis and cellulitis and all these other things. Some people might go to a dermatologist thinking they got a skin deal. And how often does the dermatologist tell a patient, you know what, I'd love to be able to say that I can help you with this, but this looks like it's a venous situation. How often does that happen with dermatologists?
That happens, actually, sometimes. But sometimes it doesn't. Sometimes even another specialist is not going to make that connection. But which brings up a very interesting point, important point, and that is that a lot of people, a lot of people with skin problems in the lower legs that ultimately end up in our office have already been to their dermatologist. Because not only does the skin become discolored, but in venous disease, you can also have a rashy sort of change to the skin. We call that venous eczema.
You're given medication for that. But can there be a point in time where your skin, no matter how much of that you put on it, just doesn't respond?
Well,
because that's not the problem.
Exactly, and that's it. They often. The patients often will be treated for a dermatologic problem, and they identify the fact that it's not working. But yeah, most dermatologists probably recognize skin changes that are associated with venous insufficiency, and then they send them over. Sure.
Okay, because now we're looking at this, and there's a couple of other things, and we're going to get into one more myth in a minute. Then we'll get into something else. But I don't want you to think that there's nowhere else on your body that's a problem. But sometimes if you have that, like this ulceration maybe on your foot, maybe that's more likely to be a diabetic situation than a venous situation. So the area of concern on the 6'6" male is really only about 8 or 10 inches.
Yeah,
where that becomes a very obvious condition.
Right. Yeah. And yeah, you're right. There's a variety of different reasons why somebody might have an ulcer on their foot or lower leg, lower extremity in general. It's either arterial, or it's venous, or it's diabetic, and thrown in there is something called neuropathic. But there are very specific reasons why various different ulcers show up, and they all have very typical appearance.
Okay.
Yeah, you're right. I mean, a diabetic ulcer, typically we see those more on the bottom of the foot, and they have a very typical appearance. They've got a lot of callus around the periphery of the ulcer, as opposed to arterial ulcers, which are usually more on the tips of the toes, furthest away from the heart kind of thing. And they're usually pale, and they have their own typical appearance. And then the venous ulcers, you're right. Usually from the ankle to mid calf.
Yeah, and that's why, and that's why in many respects, it's easy to understand these days why more and more people have become specialists. And I do know that's a great question for you before we go to our final one, which is another one for you ladies coming up in a minute. And that is, what made you make the decision, okay, that's the area that I want to be in? Because I do know that in this day and age, almost all medical professionals are specialists of some kind. You don't see as many as the old doc knock on the door, house call doctors anymore. It's gone out because of the way we live has changed.
Sure. Yeah. I mean, for me, one of the big reasons that I kind of wanted to specialize more in, venous problems, and I had done, I treated vascular problems for a long, long time. Mm-hmm. I did peripheral vascular, arterial surgery, heart surgery, etc. But there's a lot of new technology in venous disease, which has been very, very interesting. Number one, number two. Venous disease has been tremendously undertreated for many, many years. Now, part of that has to do with evaluation. 25 years ago, we didn't have the ultrasound machines that we have
exactly.
Today.
Great point. I love that.
And the ways that we had to diagnose venous insufficiency were a lot more either cumbersome or invasive or whatever, but and inaccurate. Yeah. So I mean, the ultrasound machine has made a tremendous impact on our ability to diagnose venous disease, but also the procedures. The procedures that we had before were not very palatable. Yeah.
Nobody looked forward to going in. I'm going to go have my veins done today. Yes. Yeah. Nobody thought that. Yeah.
For the patient or for the doctor. I mean, I can remember when I was in training, and it was the guy who had to go do the vein stripping that day was sort of the low guy on the totem pole.
Because that's a hard job.
Because, nobody wanted to do it. So,
by the way, real quickly on that, isn't it true that back in some day that actually removing that vein, it doesn't want to come out? Sometimes it's not as though it's not like you just take a straw out of a cup. Things are holding on to these veins.
Oh, yeah. Yeah. Yeah, and that was part of the the problem with recovery. And there was back then when we did vein stripping. I mean, people were in the hospital 2 or 3 days. They had a tremendous amount of bruising. I mean, it was very, very uncomfortable, and they were in bandages for a long, long time. And they had a huge amount of incisions all over their legs.
Jeez.
We don't do any of that anymore.
Yeah, you can't even see them. Band-Aid. Okay, now here's one. I like this one because I do know that I want to talk in a minute a little bit about plantar fasciitis, which is like this big trendy thing. Oh, I got plantar fasciitis. That explains a lot. What about this one? Mom says, wearing high heels over the years led to my vein problems. Yeah. And it probably led to some posture problems, but can it irritate or can it cause a vein problem? Well,
I added that because the answer is, to some extent, yes and no. Mm-hmm. Is again, and we kind of go back to a couple of the other points, is wearing high heels alone. I mean, if that's all you have, is wearing high heels, is that going to cause you to have varicose veins and venous insufficiency? No, probably not. Because usually there are other factors involved, genetics most notably. But the other aspect of that question, though, however, goes to something that we call the calf muscle pump.
Yeah, which is really important. Everybody knows about the heart up there in your chest. It's a big old muscle, and it's pumping that blood, that rejuvenated blood, and it's just flinging it out to your whole body. Yeah. But you don't have one in your legs bringing it back up.
No, you don't have another heart. You don't have a bunch of little hearts all over your body bringing it back up. So, the way that veins work are, number one, when they're functioning properly, they have little one-way valves that keep the blood moving up. But in addition to that, it's also very, very reliant on muscular activity in our legs. So the calf muscle contracts, pushes the blood through the veins, and hopefully the blood's going to go only in one way because of these one-way valves. That's when everything's working properly. So there are many reasons, or there are a number of reasons why, people who have muscular problems, muscular dystrophy, or, have had strokes and stuff, where the muscles aren't working properly, and that does impact a certain amount of venous insufficiency. Okay, now the other thing about it real quickly is that it looks so unnatural. And I put on a pair of high heels, this gorilla-sized high heels that they added at the Playhouse. It's very tough. Yeah. I mean, and so I see that women put up with a lot of pain to get that look. And I guess what they want is that highly developed calf look. Yes. Yeah. Can you believe how high some of them are? No. Yeah. I can't. When I see some of them, I can't imagine walking. Plantar fasciitis. Yes. Trendy thing. What is that? Well, it's I can't say that I'm an expert in plantar fasciitis, but it's an inflammatory process of the bottom of the foot. The bottom of the foot is a very special kind of area. The skin is very, very thick. There's a lot of tendons and a lot of muscle and bones all sort of interacting. And it is. I guess I agree. It's sort of a trendy diagnosis these days. But I think there is definitely something to it. Sure. I mean, as there is carpal tunnel syndrome, a lot of other things we can talk about. Okay. I hope you've had a little fun with us today. It's been kind of interesting because there's method in the madness. You have to be able to smile and stuff, but some of these things are immediately fixable. And I want you to take a look at yourself on your own at the website. Go to veinclinicsofhawaii.com, veinclinicsofhawaii.com. There's a myriad of good stuff there, even doing some finger walking on the internet. But when it comes time, like Dr. Juleff said in the very beginning when we first started doing these shows, that ultrasound examination, boy, that's going to set you down the road on finding out what's wrong with you, and more importantly, how can they all get fixed. So we hope you've enjoyed the show. Tell other people about it whenever you get a chance. Go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. And we'll see you next time. Healthy, healthy, healthy for you, we hope.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.